Hello everyone, myself Miss Rani Tonde from B Farm second year from P.R. Pote Patil College of Pharmacy, Amravati, guided by Professor Sohani Solanke ma'am. My topic is Helicobacter pylori bacteria. Now see the contents, means the points which are we going to be discussed here. Scientific classification, structure, culture, causes, pathogenesis, symptoms, diagnosis, treatment and prevention. First we can see scientific classification. Domain bacteria, phylum Proteobacteria, class Epsilon Proteobacteria, order Campylobacteriales, family Helicobacteriaceae, genus Helicobacter, species H. pylori, binomial name Helicobacter pylori. Now see the structure first. It is a gram-negative bacteria. It has spiral helix shape. It can grow in both an anaerobic and microaerobic environment. It is a motile bacteria, which is a homologue of eukaryotic. It has flagella, which is lophotrichous. Now, what do you mean by lophotrichous? Lophotrichous means flagella are attached at the same point. Size H. pylori is about 3 micrometer long with a diameter of about 0.5 micrometer. Now you can see a diagram. In this picture you can see the whole structure of H. pylori bacteria. Here are 7 factors with the help of which bacteria works. Firstly, flagella, ureas, lipopolysaccharides, outer proteins, exotoxin, secretory enzyme, type 4 secretion system, with the help of which the bacteria works. These are the bacterial structure of Helicobacter pylori. Now, how can we culture the bacteria? First, strict microeconomic 5% oxygen, 10% carbon dioxide and high humidity is required for growth of bacteria H. pylori. Optimum temperature 37 degrees Celsius, can grow in freshly prepared blood agar and a chocolate agar. After 3 to 5 days, colonies are seen circular, convex and translucent. Now, what are the causes of that bacteria? Means what the cause H. pylori causes. First, it can cause chronic active gastritis, duodenitis, peptic ulcer disease, maltoma, carcinoma, stomach. But peptic ulcer is a main cause of H. pylori bacteria. Now, let's see the pathogenesis. Human mucosa is natural reservoir and antrum is a main site of H. pylori bacteria. Let's see. Firstly, organisms are attached to the mucus secreting cells of gastric mucosa. Then production of large amount of ammonia from urea by bacterial release. Ammonia neutralizes HCl in stomach, cause organism survival, plus inflammatory response which cause damage to the mucus. Thus gastritis plus peptic ulcer occurs. Let's see what are the symptoms. If you have an ulcer, you may feel a dull or a burning pain in your belly. It may come and go, but you will probably feel it most when your stomach is empty, such as between meals or in the middle of night. It can last for few minutes or for hours. You may feel better after you eat, drink milk or take an antacid. Now, what are the other signs of an ulcer include? It includes bloating, means the inflammation of body parts, burping, not feeling hungry, nausea, vomiting, weight loss for no clear reason. How can we diagnose this bacteria? Let's see the diagnosis. If you don't have symptoms of an ulcer, your doctor probably want to test you for H. pylori. But if you have them now or have in the past, it's better to get tested. Medicines like non-steroidal inflammatory drugs can also damage your stomach lining, so it's important to find out what's causing your symptoms so you can get the right treatment. Here are a few tests with the help of which we can diagnose the bacteria. Test of your blood and stool, which can help find an infection. Urea breath test. In this, you will drink a special liquid that has a substance called urea. Then you will breathe into a bag, which your doctor will send you into a lab for testing. If you have H. pylori, the bacteria will change the urea in your body into a carbon dioxide, and lab tests will show that your breath has higher than normal level of the gas. Upper gastrointestinal endoscopy. In a hospital, a doctor will use a tube with a small camera called an endoscope to look down into your stomach, throat, and into your upper part of small intestine. The procedure may also be used to collect a sample that will examine for the presence of that bacteria. You may be asleep or awake during the procedure, but you will get medicine to make you more comfortable. Then upper GI test. In a hospital, you will drink a liquid that has a special substance called barium, and your doctor will give you an X-ray. The fluid coats your throat and stomach and makes them stand out clearly on the image. Now CT scan. CT scans means computed tomography. It's a powerful X-ray that makes detailed picture of the inside of your body. If you have H. pylori, means you infected by H. pylori bacteria. Your doctor may also test for your stomach cancer. This includes some physical exam like blood test to check for anemia. When your body doesn't have enough red blood cells, it could happen if you have a tumor that bleeds. Fecal occult blood test, which check your stool for blood that's not visible to naked eye. Last one is a endoscopy. What's mean the endoscopy? Endoscopy mean a small equipment introduced into your body to see the internal body parts. If you infected by H. pylori bacteria, then how can we treat them? Let's see the what are the treatment for that disease. If you have ulcer caused by H. pylori, you will need to treatment to kill the germ, heal your stomach lining, and keep the sores from coming back. It's usually take 1 to 2 weeks for treatment to get better. Your doctor will probably tell you to take a few different types of drug. This option including following: antibiotics to kill the bacteria in your body, such as amoxicillin, clarithromycin, metronidazole, tinidazole. You will most likely that at least two from this group. Then, drug that reduce the amount of acid in your stomach by blocking the tiny pumps that produce it. They include dexlansoprazole, lansoprazole, pantoprazole. Also, with antibiotics, you can take a bismuth subsalicate, which may also help kill H. pylori along with your antibiotics. Medicines that block the chemical histamine, which prompt your stomach to make more acid. These are cimetidine, famotidine peptide, and nizatidine. Now, see what are the prevention we can take. You can protect yourself from getting an H. pylori infection with the same step you take to keep other germs at bay. First, wash your hands after you use the bathroom and before you prepare or eat food. Teach your children to do the same. Avoid food or water that's not clean. Don't eat anything that isn't cooked thoroughly. Avoid food served by people who haven't washed their hands. Thus, these all are about H. pylori bacteria, and all the information here are detailed. Thank you very much